let's move to the next speaker on the topic role of homeopathy in curing factor V deficiency. It's a great honor to introduce Dr. Gulam Yasin, DHMS, PHMS, currently serving as National Vice President of Liga Medicorum Homeopathica Internationalis and President of Sahar Welfare Foundation, Pakistan. Dr. Yasin is an internationally recognized guest speaker and presenter with remarkable clinical expertise in complex hematological disorders. His specialization includes leukemia such as AML, CML, ALL, and pure red cell aplasia, hemophilia, and factor deficiencies, thalassemia major, and rare genetic disorders like Johnson-Bizard disorder syndrome. For 16 consecutive years, he has led free medical camps dedicated to blood disorders and is currently providing free treatment to over 1,200 patients with life-threatening hematological diseases. A published author and respected researcher, his work in clinical hematology has received over 85,000 reads on research scale. Doctors, please join me in warmly welcoming Dr. Gulam Yasin. Doctor, please.
Thank you very much, Dr. Abid, for a nice introduction. Dear colleagues and distinguished guests, it's a sincere pleasure to stand once again on this stage, graciously hosted by the Ayush organizers, following my presentation on uterine cancer at our last conference. I'm honored to share two more compelling cases today, and this time focusing on factor V deficiencies. This is the story of two siblings, a sister and a brother, whose lives have been profoundly shaped by the rare genetic conditions. From years, their family lived in a state of constant crisis. The unpredictable nature of spontaneous bleeding meant they were perpetually on the brink on an emergency, requiring frequent hospitalization, FFP transfusions, and factor V injections in all hours of the day and night. So it's a review. What is the factor V deficiency? The severity of bleeding often correlates with how low the factor V levels are, but symptoms can range from mild to severe and life threatening. And almost in Pakistan, it's really a life threatening because people have no services about the health, and especially in periphery, no treatment available for these children, and polyclinics are not treating these children, even not giving an single injection. Mild to moderate bleeding, easy bruising, nosebleed, epistaxis, bleeding of the gums under the skin, petechiae or purpura. It's the main symptom of this factor V deficiency, and all factor deficiencies, especially in hemophilia, factor VIII deficiency too. Heavy or prolonged menstrual bleeding in women, excessive bleeding after minor trauma, dental work, or surgery, severe bleeding in the most severely affected individuals, often with less than 1% of normal factor V activity. The risk of life-threatening hemorrhages increasing, especially in Pakistan and especially in the world. Only 6 to 8,000 kids are going down every year and facing the deaths and leaving their parents sad and with sorrow. Bleeding inside the skull, intracranial hemorrhages, bleeding in the gastrointestinal tract or lungs, umbilical cord, stump bleeding in newborn babies. So the causes inherited, definitely it's an inherited uh, autosomal recessive pattern, and this means a person must inherit a defective factor V gene from both parents to develop the severe disorder. And acquired, and unfortunately, maybe in India too, in Pakistan, massive kids are coming to us for treatment which are acquired. In periphery, practitioners of the traditional allopathic doctors using antibiotics, fourth generation antibiotics in little kids, 2 or 3 years kids, which have fever and which have bleeding or so, and they are using steroids frequently. There is no law, there is nothing is so acquired cases are coming very fastly in our free camp, and there is a rare and can be caused by the body producing abnormal antibodies that attacks and inactivate the factor V proteins. This is sometimes associated with certain autoimmune diseases or cancers. But in our area, it's especially due to the contaminated water and a large uh, arsenic album in our Lahore water, contaminated water by the arsenic album. We will share my experience next, inshallah. The homeopathic perspective is patient profile. Anas brother, 4 years, diagnosis factor V deficiency, and factor level was only 4%. That's why day and night bleeding was started, and they must hurry up to go hospital. And his sister, younger sister, age 2.6 years, diagnosed factor V deficiency, and her factor V level was only 1%. So this is the report of ANS, and this is the front page of our Sahar Welfare Foundation. Under Sahar Welfare Foundation, we are treating free of cost more than 1,200 patients. And why we are treating, I will experience my share next. And this is 4% only report is showing his factor V level is only 4%. And this is the report of Ayat, our younger sister, only 1% of factor V deficiency. So the remedies we are using in our free camps, that is acetic acid. Maybe someone is also practicing in hematological cases, but hematological cases have the major issue of selecting our remedy and selecting our potency. So acetic acid, hemorrhages from nose, lungs, stomach, bowels, uterus, also passive hemorrhages, blood vessels contracted, and in females, metrorrhagia with great thirst after childbirth, excessive menses and hemorrhages after labor. And I am using this acetic acid in 200 potency in especially children 4 or 5 years to 10 to 12 years, and weekly 2 doses, after 4 days, after 3 days 1 dose, and results are really very excellent. Crotalus hor, maybe you here heard the news in 2012. We faced a dengue fever in Lahore, especially here in Punjab, Pakistan. So Crotalus hor was used by homeopath doctors massively, and we faced after effects of the Crotalus horse, disorganization of the blood, and many kids especially affected that Crotalus horse and disorganized the blood. So the bone marrow was suppressed, and many cases of acute leukemia, myeloid leukemia, and factor deficiencies was appeared. So Crotalus horse is a great remedy. General disorganization of the blood. I am using this medicine in acquired especially, which have used steroids or something else or antibiotics medicine. The results are excellent. So from every part of the body, even pores of the skin, that is a major symptom of the Crotalus horse. Slow oozing of dark thin blood, not clot from all the orifices and surfaces. Dark and bluish parts, bloody pus, sweat, and blood oozes from the ears. Adrenaline, I'm also using this adrenaline in 200 potency. It's also a vasoconstrictive, therefore most powerful and prompt, astringent and hemostatic, and invaluable in checking capillary hemorrhages from all parts. Where local or direct application is feasible, nose, ear, mouth, throat, larynx, and stomach, the results are very excellent. And arsenic album, which I am uh, asking about, the arsenic album, we in Lahore have contaminated water, especially with arsenic album. So leukemia's cases are massively diagnosing. So we use 1 or 2 doses of arsenic album to antidote that contamination of arsenic album. And hemorrhages of arsenic album are black, offensive blood, and blood is disorganized, causing anemia and severe septic condition. And I'm using this arsenic album also in acquired cases from periphery treatment of steroids and antibiotics. Ferrum phos hemorrhages and disorders of veins increases hemoglobin, hemorrhages bright from any orifices. Uh, I have experienced in thalassemia cases more than 800 cases and more than 400 cases of factor deficiencies. Ferrum phos is a live for factor deficiencies cases and a poisonous for thalassemia cases. Mostly in initially practices, I used ferrum phos 3x in thalassemia patients, and their ferritin level was increased very high. So the spleen enlargement came over there and a liver enlargement came over there. And now I am using ferrum phos only 200. Weekly 1 dose or fortnightly 1 dose. Never use now 3x in thalassemia patient. But in hemophilia patient, ferrum phos 3x is an excellent remedy to stop the bleeding. Ipecac, it's also a great remedy. I'm using mother tincture in adult and 3x in small kids. Hemorrhage is bright red and profuse, and discharge are foamy. That is the characteristic symptom of Ipecac. Nosebleed, bright red gushing hemorrhages with nausea and vomiting of blood. Uterine hemorrhages, profuse, bright, steady flow or gushing with nausea. These two tools are really great. One is gallic acid and the second is Granium maculatum. I'm using locally, soak with the cotton and little pressure with the thumb. It stops the bleeding within few seconds or sometime within few minutes, which needs factor 5 deficiency injection or factor 8 deficiency injection. And it cost one injection almost 20,000 rupees of Pakistan. So we have many families which have 3 to 4 cases of hemophilia or factor deficiencies, and it's a big financial crisis after purchasing the 20,000 injection for one baby, and it at least more working for 24 hours only, and after that bleeding will start. But the homeopathy, these gallic acid and Granium maculatum I am using 3x, and gallic acid I am using in mother tincture 10 to 15 drops 4 times a day. So Lexis Muta, decomposed of blood, rendering it more fluid. I am very careful to use this remedy only with peculiar symptom. I am using this one, otherwise it's very dangerous remedy in my life practice. So Lactoductus mactans, blood becomes thin, watery, load and coagulability, chronic idiopathic thrombocytopenia. Millefolium, one of great remedy in hemorrhages, affects the capillaries of lungs, nose and uterus. There are massively problems which patients have internally bleeding. Okay, thank you very much. So millefolium and natron sulph are excellent remedies in internal remedies to stop the bleeding. So That is the reports. You can see Mr. Anas, after 18 months of the treatment, homeopathic treatment, his factor level is 76%, which is normally 70 to 120, and his younger sister Ayat have 72, and normal factor level is 70 to 120. So dear, I'm not a scholar, but I have faced a pain. I blessed a son in 2008, and within 30 to 35 days, he was diagnosed pure red cell aplasia. So, our largest hospital in Lahore, Children's Hospital, they said we have 2500 years history of the medicine. There is no cure about this case. As a father and as a homeopath, I faced a mountain of despair, but I took challenge as a homeopathic doctor, and after 3 months of homeopathic medicine, Calcarea fast, which our madam said, after 3 months of Calcarea fast 3x, my son was turned deathly white to pink. And after 9 months of the medicine, he was completely cured from pure red cell aplasia. Basically, the problem was despairing me. He was associated with a rare syndrome at that time. Only 28 cases worldwide, Johnson Blizzard syndrome was diagnosed, and one of my son. His liver was on left instead of right, and his spleen was on left instead of left side, right instead of left, and his turn was heart was turned dextrocardia. So pancreatic insufficiency was there. So they said, okay, there is no cure of this cases. So my mission is that miracle presented me with a choice to use this experience for profit or to use it to serve. So I choose later. Today, I am treating more than 1200 patients in Pakistan under Sahar Welfare Foundation. We are treating thalassemia patients, more than 800 patients of thalassemia major, aplastic anemia, acute myeloid leukemia, acute lymphoblastic leukemia, chronic myeloid leukemia, chronic lymphoblastic leukemia, aplastic anemia, pure red cell aplasia, factor 1, factor 5, factor 7, and factor 8 deficiency with excellent success. Thank you, homeopathy. Thank you, the creator. And thank you, Yosh, to share some words. Thank you, everyone.
Thank you, Dr. Ghulam Yasin, for addressing such a rare condition. It was both informative and professionally enriching. I'm happy to know that homeopathy helped your baby in such a rare case. Our next topic is a survey outcome on homeopathy's experience on hemorrhoids.